Today I'll be talking about schizophrenia and first rank symptoms of schizophrenia. Schizophrenia is a severe and chronic mental disorder which has been recorded throughout history. And symptoms have been seen emerging from the early teens to the late adulthood, that is from about 15 to 20 years of age to 35 years of age. People suffering from schizophrenia, there is a total loss of reality contact. So here the mind gets so fragmented that there is a disorder of thought, disorder of speech and disorder of behavior. And people suffering from schizophrenia, it becomes so disabling and disturbing for them that it becomes difficult to hold a job or to care for themselves, and it poses a major burden for the family of the sufferers of the schizophrenia and the society as a whole. Next we come to the first rank symptoms of schizophrenia. Schneider in 1939 first proposed this term first rank symptoms for the general physicians, and later in 1959 in his book Clinical Psychopathology he included this term first rank symptoms. It not only gives us a clear-cut diagnosis of schizophrenia but also distinguishes from other affective disorders. So there are about 11 symptoms of the first rank symptoms. First we come to the auditory part, and it is divided into three groups, that is the auditory thought, auditory commentary and auditory action. The first is the auditory thought. Whatever the patient is thinking, then there is a thought echo of the same kind. Like the person is thinking, I'll go to the market, so there is a thought that I'll go to the market. Next is the auditory commentary. Auditory commentary is where there is a continuous commentary of the person's actions and thoughts. So it becomes so disabling for the person that often he behaves in an aggressive manner and gives out and acts out on the thought, or he self-harms. Next is the auditory action, that there is a commentary of the people's actions. Whatever the person is doing, there is an auditory voice of it, and there is also the voices within. It might be of 2 to 3 people, or persons talking among themselves or commenting on the person's behavior or actions. Next we come to the formal thought disorder, and it is also divided into 3 groups: thought insertion, thought broadcasting and thought withdrawal. First is the thought insertion. Here a particular thought is inserted in the person's mind. Here the person feels that the thought is not of his own but it's some external power or some external forces. It might advise them or it might threaten them, and the person feels that the voices are real and he acts upon those thoughts. Who is trying to control you?
I don't know, ma'am. All these hospitals, members in the hospital all look like some sort of, they know black magic actually. So through black magic they are controlling my mind.
Your mind, right?
Very advanced technology.
Very advanced technology. Okay. So do you feel that they are putting thoughts in your mind or ideas?
Yeah, as well as thoughts, both.
Putting
thoughts in my mind.
Okay. What kind of thoughts are they putting in your mind?
First it was some lecturer's thoughts, and mom mentioned this. First it was lecturer's thoughts.
First it was?
Lecturers meaning lousy, dirty.
Okay.
Dirty thoughts.
Dirty thoughts in your mind. Okay. Regarding what? Which topic they are putting dirty thoughts in your mind? Regarding? Porn. Okay. Next we come to the thought broadcasting. Here the person feels that whatever the person is feeling or thinking, it has been broadcasted. The people surrounding him comes to know about what the person is feeling. He feels that the other people are able to read his mind and read his actions, and feels that people are conspiring against him and bullying him. So next we come to the thought withdrawal. Here a patient sometimes suddenly stops talking, or he's not able to reconnect to the previous trail of thought. So he often feels that his thought have been taken away by some external forces. Next there is delusional perception. Delusional perception is where the person gives a bizarre meaning to a normal thought, normal ongoing actions. He gives a bizarre and private and illogical meaning. Suppose he might feel that the color red of his surrounding and he may infer the color red of things like sofa or people's clothes or anything in the environment have been put there intentionally to copy him or to spy on him, so the person feels that he's been spied on.
Red means blood, blood means a vampire. So indirectly when I see the color red, it makes me a vampire.
You feel like you will become a vampire then. So you can make out different meanings from different colors.
Different colors, yes. No,
Okay.
my brain works naturally.
Okay.
I don't know.
Just somebody put those thoughts in your mind.
Maybe it was a mixture of my thoughts and their thoughts.
Next is the somatic passivity. There is a bizarre bodily sensation of the patient where they make bizarre postures or they may feel bizarre sensations in the body and may infer it to some external forces or external power that is controlling him. He feels that his body and mind is being controlled by some external forces. So these are the 11 symptoms of first rank symptoms of schizophrenia, and thus it helps us makes a clear-cut diagnosis from the other affective disorder.